So today we're going to step forward and have a look at what antidepressant commercials look like now, kind of in the last couple of years. So let's dive in and have a look at the commercial for Rexulti, a add-on treatment to antidepressants for treatment-resistant depression.
Partial response. That's when your antidepressant helps, but it's only part of what you need, and you're still left masking how you really feel inside. It's not your fault. Many people still experience depression symptoms, even on an antidepressant.
So they make it seem like if you are feeling bad and you're on an antidepressant or you're not having a full response, that your depression is just undertreated. It is so much more complicated than that. I know a lot of people who take these medications, and what they would say is partial response is kind of just like a direct effect of this medication. So for instance, if you take it like Zoloft or Lexapro or some of these mood constricting antidepressants, a lot of people feel quite emotionally numb and disconnected, and they can confuse that as being symptoms of ongoing depression because they feel flat. And so I think a lot of people are actually having this kind of flat dysphoric feeling from these medications, and then they're going to see ads like this and think, oh, I need to just add something on because I'm still not feeling completely well, where they might not be feeling completely well because of a side effect from their current med.
But together with your doctor, there are things you can do, like adding Rexulti. When added to
adding Rexulti, or maybe a more comprehensive assessment where they look at the drugs and see, hey, maybe they're not working for you anymore and you might need to kind of wind down on them if you're having a side effect. Or maybe even non-drug interventions like, are you socially isolated? Do you hate your job? There's a million things that you can do aside from adding Rexulti, which we'll see soon, has a list of side effects that are so frightening. It's kind of unbelievable that people would really consider taking this.
Antidepressant. Rexulti was proven to reduce depression symptoms 62% more than the antidepressant alone, so you can build on your progress.
Rexulti can cause serious side effects. Elderly dementia patients have an increased risk of death or stroke. Antidepressants may increase suicidal thoughts and actions, and worsen depression in children and young adults. Report fever, stiff muscles, and confusion, which can be life-threatening, or uncontrolled muscle movements, which may be permanent. Increased cholesterol, weight gain, high blood sugar, low white blood cells, unusual urges, dizziness on standing, falls, seizures, trouble swallowing, or sleepiness may occur. When depression sets you back,
I mean, that is a terrifying list of side effects, and they can all happen. So really, if you are going to consider taking this medication to kind of boost your depression treatment, you would have wanted to have exhausted all other options and be absolutely confident that the meds that you're on aren't contributing to your worsening. Unfortunately, this is not what we see happening today in practice. Patients will come in for an outpatient follow-up visit. They'll see their doctor for 20 minutes. They'll say, oh, I still have depression. The doctor will say, oh, maybe we'll just add some Rexulti on top of it. And that's the extent. That is the extent of the intervention at that stage. It's not like, we're going to send you to therapy, how are things going with your therapist, what else is going on. They simply do not have the time to do that. They do not take the time to do that. And that's why we have so many people out there with treatment-resistant depression now getting kind of loaded up with antipsychotics that are just kind of, they worsen the problem long term. Unless you can get to the root of it, if you keep on stacking medications on, especially ones with dangerous side effects, people end up in a worse place long term.